My name is Dr. Jillian Wong, and I'm an optometrist who regularly treats dry eyes with a technique called Meibomian gland expression. Today we're going to be watching two videos from the same patient separated by 2 weeks, with the differences is being the way that we heated the eyelids. For this first video, we're watching the Meibomian gland expression after a heated eye mask. So what we're looking at in this video is someone's bottom eyelid, their left bottom eyelid, and then there's me with the Collins Expressor forceps, which is that metal forceps touching the kind of surrounding the bottom eyelid. So the patient is anesthetized, so it's not that painful, although they can feel some pressure from the outside paddle because the anesthetic is only for the eyeball itself in the form of an eye drop. Here we can definitely see the differences in the meibum quality. So pretty much that thick little strand over there is a very unhealthy strand of meibum. Meibum is the name of the oil from the Meibomian glands. And the Meibomian glands are the glands that are in the eyelids that produce the oil. Each opening that you see is the opening of one Meibomian gland. Basically, there is a spectrum of the type of oils that can come out of the eyelid. Normal would be thin and clear, and then actually on the worst part of the spectrum is this thick toothpaste-like secretions that you can see in some of these oil glands. The thicker the oils are, then the worse the Meibomian gland dysfunction is. If the oils are this thick, then there's pretty much no way that the oils are going to be flowing normally because they are supposed to come out every time you blink. But if they require this much heat and pressure for it to move, then most likely it won't be coming out after just one blink. For my process, I go from the bottom left to the bottom right, and then top right to top left. So here is the top left gland. Here we can see that there isn't as much strings coming out. It kind of looks like it's blocked. Previously in the video, I actually wasn't too happy with the bottom left. So here I went back in this case. I will sometimes do that if I think maybe I missed some, in which case this one I thought I did. So there is still a little bit coming out, although for the most part there's not tons that came out after the hot pack. So now we can move on to the next video, which is the same patient after doing IPL. IPL is a really great treatment for treating more severe dryness. If you probably realized from the other video, this patient actually does have quite a few of these very thick abnormal meibum strings coming out of her eyelid, which means that she does have both more severe dryness and more severe meibomian gland dysfunction. IPL is a technology that's been used for many years in dermatology. They found that people who had recently done IPL did notice improvement in their dryness, so they've recently used this technology more often now in optometry to treat dry eyes. IPL will work to treat the root cause of dryness, which is the inflammation in the eye. There are other treatments available to treat dry eyes, which typically include artificial tears, hot compresses, eyelid scrubs, but unfortunately these treatments only focus on temporarily relieving symptoms instead of treating the root cause of the dry eye. For the IPL process, typically first we need to make sure that the skin is clear of any oil and makeup, so I typically ask patients to wipe their face or clean their face with a facial wipe. Second, we get the patient to put on protective goggles to protect the eyes. The light is extremely bright even with these goggles, so I just tell people to keep their eyes closed even though they're wearing those goggles. Next, we'll use a layer of thin, cooling ultrasound gel underneath the eyes and wherever we're going with the IPL. Then we use a small handheld device to deliver pulses of light to the area around the eyelids. Also, typically I treat the entire face because that will also cut off some of the inflammation from the other places of the face. Also, these IPL pulses pretty much will cause heat to be delivered to the Meibomian glands, which helps melt the oils a little bit better. Then afterwards, we clean off all the gel, and then we will continue on with the Meibomian gland expression, which is seen in this video here. Therapeutic Meibomian gland expression, which is the videos that I record, has been shown to improve the meibum production and decrease dry eye symptoms, especially in comparison to conventional treatment with artificial tears alone. While both IPL and Meibomian gland expression can be done separately, a study in 2016 found that IPL will be most effective when used to supplement Meibomian gland expression. This means that if we do both of them together, then we'll have the best results for dry eye symptoms. This study found that the combination of IPL and Meibomian gland expression can significantly improve dry eye symptoms in 89% of patients and improve Meibomian gland function in 77% of patients in at least one eye. So based on that 2016 study, then we can consider IPL and Meibomian gland expression combination to be one of the best things that we can do for dry eye patients. But I do offer Meibomian gland expression alone at my clinic, so rarely do I ever get to see IPL or the heated eye mask video side by side. So that's what we're going to be watching right now. So IPL video on the right, after the heated eye mask on the left, and then like I said before, it's the same patient. So even on this first video, we can see that there's actually much more of the meibum coming out after the IPL side versus the heated eye mask. Even after the heated eye mask, there's some glands that aren't expressing where they are expressing in the IPL, which means that IPL can be seen that already it's more successful. If there are glands that don't express, then occasionally we can be worried that the glands will be blocked for a long time. The longer they're blocked, then the more likely they could atrophy and die off. That would result in more severe Meibomian gland dysfunction, and then that also means that it's even harder for us to treat. So typically the Meibomian gland expression treatment will rely on the glands being open. So now we're looking at the IPL on the right side, and then in some cases you'll see that comparatively where the oils are super thick and they're standing up by themselves, then the IPL has probably melted enough that it doesn't stand up by itself, which means that it has been more effective in heating up the oil glands. Typically, it's the light energy from the IPL that warms the Meibomian glands, and then this helps make the expression easier. So it's kind of nice to see in video form that it definitely looks more melted after the IPL. Also, there's evidence that after the IPL, it can help to restore the function and the morphology of the Meibomian glands. There's other mechanisms too that are important for the IPL function. So number one would be that, like I said earlier, is that IPL actually is an anti-inflammatory type treatment. In that case, it's because if there's any stray blood vessels or ocular rosacea that's present on the eyelid, then Meibomian gland expression won't do anything for those blood vessels, but IPL actually can help coagulate them. So once they're coagulated, then we can decrease that pathway of inflammation, and then on top of that, it will also make your eyelids look less red, which is important for aesthetic purposes. So in this video, we can kind of tell that some of the stringy oils on the heated eye mask side actually were completely liquid on the IPL side. Another important thing for IPL is that actually it can decrease the amount of bacteria and the Demodex mites that can, also increase the inflammation in the eye. So in this video too, then we see that there's like these strings that are coming out of the eyelid versus you can kind of just see the white head coming out after the heat pack. So it kind of looks like there probably maybe was some strings that wanted to come out after the heat pack, but they weren't melted enough. So then you see it in the IPL one. So though it's kind of subtle to see the difference between the IPL and after the heated eye mask, I hope you guys were able to notice the difference. IPL, I think, is definitely the way to go if you have the funds to do so. That's the only bad part, is that sometimes it is an out-of-pocket cost, but definitely worth it if you're suffering. Otherwise, thank you so much for watching. Please like and subscribe to support my channel, and I'll see you again soon.